Hi, I'm Dr. Keith Schoen from Hill and Harbor Veterinary Center. Last week we talked about how you can assess your pet's mouth. Now, if you have any concerns and you do go to your veterinarian, well, what can we do? Well, the first thing that we'll do is we'll have a look in the mouth in the consultation room. The problem is that pets have a lot of teeth. Dogs, for example, will have 42 teeth. So it's nearly impossible to get a really good assessment in the awake patient just right there in the consultation room. So what we'll recommend doing is anesthetizing our patients and actually having a look and charting the teeth. Now what's involved with charting is taking one of these probes, just like when we go to the dentist, and what we're going to start doing is we're going to look at the crowns of the teeth. We're also going to measure the gums around the teeth. And that's going to give us assessment of what's happening underneath the gum line, at the level of the tooth and the gums with the gingivitis. The other thing that we'll usually try to do is get a set of full mouth x-rays. Now the x-rays are going to allow us to see what's happening underneath the gum line at the level of the bone surrounding the tooth, the periodontal ligament, which we talked about ends up holding that tooth in its place, and at the level of the root of the tooth as well. So now once we end up assessing what's happening below the gum line and above the gum line, we can marry the two and come up with an assessment as to the stage of disease that we're seeing in the mouth. So sometimes we could just scale and polish those teeth. And that means that we remove the tartar that's on those teeth and the infection that's around those teeth. If the periodontal disease or if the infection under the gum line seems advanced, then we start talking about having to do advanced procedures, things like root canals or potentially even extractions. So the key to really good oral health is brushing those teeth every day and at-home dental care, which we're going to teach you how to do to prevent periodontal disease from occurring. And so we can end up just scaling those teeth, removing the infection, and keeping your pet's mouth healthy and clean, and most importantly, pain-free. Thanks so much for watching. I'm Dr. Keith Schoen from Hill and Harbor Veterinary Center.